right like that. There's the bulge going down, and here's the bulge coming back. Hello, my name is Dr. Michael Hall. I'm a specialist in non-surgical spinal decompression. Our topic today is a herniated disc. And before we describe what a herniated disc is, let's take just a moment or two and talk about what a disc is. A disc is the shock absorber or cushion that separates each one of the spinal vertebrae. There are 7 cervical vertebrae in the neck, 12 thoracic vertebrae, to which the 12 pair of ribs attach, and 5 lumbar vertebrae in the lower back. If you'll notice, right down in the middle of these lumbar vertebrae, toward the right side, you can see a red herniation, which we'll talk about here in just a moment. There are 7 cervicals, 12 thoracics matching each of the pairs of 12 ribs, and 5 lumbar vertebrae. So naturally there are going to be cervical discs, thoracic discs, and lumbar discs. In my hand, I have 2 lumbar vertebrae. The top one is clear so that you can look down inside it, which we will do in just a moment. The bottom one is plastic, but it's bone colored, and the rubber cushion thing in between is the disc. And the disc allows the vertebrae to move on one another, and as well it absorbs shock. A disc is composed of annular fibers that surround the outside edge. So annular is the same root word from which we get annual or year-round. So the annular fibers go around the outside edge of the disc, and those are thick and ligamentous. And if this top vertebrae is clear so that you can look right down inside it, and you can see that this outside edge of the disc is thick. In the center, we have the nucleus, and that's what the word nucleus means. It means the center of something, and the nucleus is composed of a thick, gooey, shock-absorbing substance. If the outside edges of the disc become injured, or over time, if they dry out, those fibers will become weaker and weaker and actually allow the inside nucleus, the gooey substance, to bulge outward. That's a problem because we have nerves into that area. If I take my 2 vertebrae and we tip it just a little bit so that you can see a little bit better, you'll notice that the spinal cord runs down the back of the vertebrae. So the round part right here is called the body of the vertebrae. Immediately behind the body of the vertebrae, there's a channel or a canal, and that canal is where the spinal cord is. When you snap the vertebrae together, it makes a hole where the nerve roots come out. If the disc were to bulge or herniate in the front, it's possible that you might not even notice that. However, just the way the structure is made, most of the weight bearing is toward the back half of this vertebrae. If it bulges toward the back, then it will begin to apply pressure to the spinal cord or the spinal nerve roots. This model right here actually demonstrates that. Now this is larger than human life size, but this will give you a real good idea that as that disc bulges, it comes right out of there just like that, and that bulge puts pressure against this particular nerve root right here. So now the bulge is going down and the bulge is coming back out, and that's what we mean by a herniated disc. So would you like to see that again? As the disc bulges, it comes right out, right here, and it puts pressure against the nerve root, which is right exactly in there. So let's get that a little bit closer so you can see it.